Hong Kong is reporting its first death from the coronavirus as the death toll in mainland China has jumped up by more than 60 in the past day. Meanwhile, officials in the U.S. are trying to keep that number low. And as Fox News correspondent Jonathan Seri tells us, they want to keep fear about the virus under control.
Public health officials say a child under quarantine at March Air Reserve Base was taken to a nearby hospital after developing a fever. The child was among 195 quarantined U.S. passengers evacuated from China aboard this aircraft last week. Additionally, a commercial passenger arriving Monday in Los Angeles with no symptoms was placed under federal quarantine and transferred to the base as a precaution based on travel history. Federal officials are considering expanding strict screening measures already in place at U.S. airports.
We're concerned about airports, but we're also looking at maritime ports as well as land ports of entry, so folks coming in from Canada and Mexico as well.
China has completed the rapid construction of one hospital and says more are on the way to house coronavirus patients in the city of Wuhan and Hubei province, the epicenter of the outbreak.
China is going to win this battle with your strong support.
This morning, Chinese authorities confirmed the death of a coronavirus patient in Hong Kong, the second death outside the Chinese mainland. The first involved the Chinese traveler to the Philippines. The World Health Organization Secretary General admonished nations to be more forthcoming with information about the virus's spread outside of China.
Without better data, it's very hard for us to assess how the outbreak is evolving or what impact it could have.
The first patient to test positive for coronavirus in the U.S. has been released from a Seattle area hospital. Public health officials continue to monitor him as he recovers in isolation at home. Of the 11 confirmed coronavirus cases in the U.S., this patient and 8 others were returning travelers from China. The other 2, spouses of infected travelers. In Atlanta, Jonathan Seri, Fox News.
A new study reveals a scary connection between anesthesia for a C-section and postpartum depression. Researchers from Columbia University looked at more than 400,000 C-section births over a 7-year period. Just 8% of the women had general anesthesia during their delivery. However, those women were 54% more likely to be hospitalized for severe postpartum depression than those who had an epidural. They were 90% more likely to self-harm or have suicidal thoughts.